The need for an organ donation is at an all-time high. According to the Department of Administration, more than 114,000 people in the U.S. are waiting for a life-saving transplant. WFMY News 2's Taylor Leverett shares the story of one recipient's second chance at life. Taylor?
Well, good morning. Asheboro resident Kathy Matthews says for most of her adult life, she felt she was in control. That is until an unexpected diagnosis that had her leaning on her faith for stability. For patient Kathy Matthews, a routine doctor's visit in 2017 was anything but normal.
They basically told me that if I didn't stop drinking, that I would basically be dead in 2 years.
Kathy was diagnosed with alcoholic cirrhosis and was in need of a new liver. Not only that, but she would also need a kidney transplant.
They were kind of inferring it, but they weren't really, I don't know if that was to protect me.
It wasn't until February of 2019 Kathy was put on the transplant wait list. 4 months later, she received her new liver. The U.S. Health Resources and Services Administration says livers are by far the second most awaited transplant. As of March, close to 4,000 North Carolinians are waiting for a life-saving transplant, according to the Department of Administration. That's why Duke Health says organ donation is so important.
Because if you have a loved one that needs a transplant, the only way to get it is if people donate.
Dr. Sudan says becoming an organ donor is simple, but there's a criteria you need to meet.
Generally speaking, you have to be healthy. You can't have a lot of, serious illnesses. Your liver has to be healthy. And it has to be of an appropriate size and anatomy.
Thanks to her donor, Keaton Hunt, Kathy now has a second chance at life. And by sharing her story, she hopes it will encourage others to give the gift of life.
When you are an organ donor, you can save up to 8 lives with your organs, and you can enhance the lives of up to 75 people.
To become an organ donor, you can sign up on our state's registry online, or you can go to your local DMV.